Hi, I'm Holly Thornton, and I'm going to be talking about assisted death. Assisted death has many names, including euthanasia, dying with dignity, or even suicide. According to Merriam-Webster, euthanasia is the act of killing or permitting the death of hopelessly sick or injured, whether it be animal or individual, in a relatively painless way for reasons of mercy. And just remember that we use the word mercy because it's showing that there is a legitimate reason for requesting this kind of treatment. There are some countries overseas who have adopted the dying with dignity or assisted death. The first was in the Netherlands, and the second to legalize was in Belgium. And now 5 of the U.S. states have adopted some form of this also, which is Washington, Oregon, Vermont, Montana, and New Mexico. At least 2 of the states say that only a patient can be the one to administer the lethal concoction. So they have decided that euthanasia wouldn't be a proper term, and they have ruled that is illegal. And they actually came up with the Die with Dignity Act, and I believe that all states should implement this in one way or another, so that if you are in a chronically ill state, you should be able to make the choice, regardless of where you live, whether or not you should be able to die with dignity. In order for a person to receive or be granted the dying with dignity or assisted suicide, they must be chronically ill and only have deemed as having 6 months left to live. And 2 doctors must agree on the prognosis. If only one of those doctors says that deems you as having 6 months left to live, you will not be granted. 2 verbal and 1 written requests with a non-family member stating that you are sane enough to make these requests. A person who opened this up for topic would be Dr. Kevorkian, and he started a major controversy when he videotaped his PAS, or physician-assisted suicide, of Thomas Uke. Because he videotaped and was shown administering rather than providing the lethal injection for his patient, he was sentenced to 10 to 25 years for murder. Another person who has brought this into the spotlight would be Brittany Maynard. Brittany Maynard was the same age that I am. And until you're faced with the same reality as her, you can't place an opinion. I have had cancer, and I know firsthand how it sounds, and if I were dealing with her prognosis, I would probably want to be dying on my own terms also. Also, as a healthcare worker, I've seen how illness can drag a person down, and one point that I would like to make would be someone who's in a vegetative state. And because there are no options as far as assisted death for these patients, I think that it's something that needs to be considered, because a person who is a vegetable may not be showing pain on the outside, but who's to say that they don't have disease where they can feel it on the inside and they just can't portray that? If that's the case, if the family decides to take them off of life support, most generally it would be removing a feeding tube. And if someone can still feel pain even though they can't show you that they're feeling pain, who's to say that it wouldn't be painful to starve to death? The last thing I want to leave you with is the Hippocratic Oath. One portion of the Hippocratic Oath that people are saying should prevent you from wanting to support assisted death would be the fact that one version says, "I will never give a deadly drug, nor will I suggest it." But keep in mind, there is another version of the Hippocratic Oath that states, "Treat the sick to the best of one's ability." And I feel that that is one reason, because you're considering how people feel and what is good for them, not everyone. And that is why I support assisted death.